Okay, so I'm going to mostly focus on respiratory and GI. Anti-ulcer will fall under GI. HIV, we just give medications to stop the virus's DNA from replicating. We don't necessarily give like antivirals. It's more like to stop the actual HIV virus from creating more. And then transplant is just like immunosuppressants. All right, respiratory, let's do upper respiratory and lower respiratory. Upper respiratory, we have Mucinex, guaifenesin. It's to thin the mucus. It's to help the patient to cough out excess secretions. It's asthma safe. You should be increasing your fluid intake to around 2 liters a day to help your body thin the mucus. Mucomyst, acetylcysteine. It's actually the antidote for Tylenol poisoning. But you should always avoid this for asthma patients. But Mucomyst is another one that helps to thin and loosen mucus. Codeine, antitussive, this is a cough suppressant. You should take it with food. You should increase your fluid intake, and this is not for COPD patients. All right, here's some antihistamines. Benadryl or diphenylhydramine is for allergic reactions, but it also blocks the histamine that creates inflammation in the upper respiratory. Contraindications, closed ankle glaucoma, urinary retention, peptic ulcers, and small bowel obstructions. Claritin or loratadine, also another one that blocks histamine. Also Allegra, which is fexofenadine, also to block histamine. But Allegra can increase intraocular pressure. Lower respiratory, these are going to be your anti-inflammatory agents and your bronchodilators like albuterol. An example of an anti-inflammatory agent for lower respiratory would be steroids. Albuterol is like the #1 drug for severe asthma attacks, and it's like the rescue inhaler. That's what that is, and you always give it before any type of steroid inhaler. All right, GI, let's move on to Antinausea or Antiemetics. Zofran, aldosterone, and Reglan, misoprostol. Lactulose is one of those that is actually to decrease ammonia levels, specifically in liver patients or patients with cirrhosis. Pancreatic enzymes or pancreolipase, they all end in ASE, and it is to help your body to break down fat and food and protein and carbs, which is what normally lipase, protease, and amylase does. Acid prevention, I'm thinking the ones that end in tidine, like Zantac and Pepsid. It actually blocks the H2 receptors in the stomach so that your gastric secretions are lower. Take it 30 minutes before meals. Prilosec protonics, they end in prazole. This inhibits the proton pump, again, reducing gastric acid. Antidiarrheal, like Lamodal, it actually works the same as like an opioid, so it literally slows down your GI tract, your peristalsis. Laxatives stimulate your colon to evacuate or soften your stool. Avoid these with renal patients and milk.